Brilliant. Are you happy to start, Elizabeth?
Yes, I'm fine. Yes, ready.
Fantastic. Well, thank you so much for being interviewed as part of this product. If you can please give me your name and tell me something about your background, that would be fantastic.
I'm Elizabeth, Professor Dame Elizabeth Anionwu, and I'm an Emeritus Professor of Nursing at the University of West London. And I'm also a patron of several charities, for example, the Sickle Cell Society and the Mary Seacole Trust.
Great, thank you so much. And Elizabeth, in which branch or speciality of nursing did you train or work in?
I did my general nursing, my 3-year course, and then I became a health visitor. And I practiced as a health visitor for 3 years. After that, I became a community nurse tutor, organising in-service training, as we called it then, for community nurses and teaching student nurses about community nursing as well. And then I ended up specialising as, well, in fact, becoming the first ever sickle cell and thalassemia nurse specialist in the country. And that was from 1979 through to 1990. And then I went into academics and became a professor of nursing at the University of West London. But actually before that, I was a senior lecturer at the Institute of Child Health in London.
Great, fantastic. And can I just ask why you chose the area of sickle cell in particular, because that seems to be a kind of a milestone in your career?
I went into sickle cell anemia, and looking back, I've realised there were 3 reasons: personal, professional, and political. If I start with professional first, it was because as a health visitor in the early 70s and visiting families with children and young people with the condition, I realised I had never, ever been taught about this illness in my nurse education programme or my health visitor programme, which were the late 60s, early 70s, and that really was quite staggering. Later on in my life, I met my Nigerian father. I'm mixed race, and my mother was white, my father was black. And I then found out that I had a cousin on my Nigerian side with sickle cell anemia. So that really brought it close to home. And then the final P is political, with a small p. I really became very angry at what I saw was the low recognition, low priority afforded to sickle cell within the NHS. And by that I mean you compare the resources allocated for care, services, research to cystic fibrosis, which of course is equally severe illness. But there were actually more cases of sickle cell disease than cystic fibrosis. And it definitely smacked of health and race inequalities to see that much lesser resources were allocated to sickle cell disease.
Well, Elizabeth, you've had a phenomenal career. Are there any highlights, but also any challenges that you would like to highlight throughout your career?
Certainly the highlight of my nursing career was becoming the first sickle cell nurse specialist. It was great to be in such a pioneering environment, working in a multidisciplinary situation, because it was with Dr. Misha Brozovic, who was a consultant hematologist, blood specialist in Brent, and she and I really formed a pioneering team. And I think that's very important to know, that one of the reasons why I enjoyed my nursing career so much was not only the specialist aspects of nursing care, which are absolutely vital, but how when you work with other disciplines, general practitioners, hematologists in my case, psychiatrists, I mean, you know, the National Health Service is, as I got more and more experienced, I was more and more amazed at the varied specialists within the National Health Service. And they wouldn't all call themselves specialists. but they were working in different areas, so in the community or the hospital, and even within those sections there were different sections within and that does make it very much more interesting, I have to say. And also you realise if you can get to know these various differences within the professions, so bring them together to help the patient and the family, the family will get a much better experience and reduce the likelihood of illness and death, of course, as well, but also it just improve the quality of life for individuals and their families.
It's fantastic. And
that was the positives.
that was a positive.
You
I
did
was just
ask
going to
me.
say, what have been some of the challenges, I guess?
Some of the challenges have been when you find that not all health professionals see life the way you do. It's fine when you find your allies, let me stress that. But you need those allies when you come across difficulties. For example, I was threatened with failure as a health visitor student simply because I dared to question the illogical way that statistics about minority ethnic individuals were being collected. It didn't make sense to me, so I asked a lot of questions, and it was felt that my attitude wasn't appropriate. Fortunately, my allies came into being and supported me and just challenged the discrimination that I was actually experiencing. So I think that was an important example for me, that don't try and keep it all to yourself when you get worried about being challenged about something that you really know is right because you've done your fact-finding work. Open up to people. It is difficult at times, but I found that always when I open up, might take some time, but ultimately there are people out there that agree with you, this is not fair, or they just want to help you out. It's not necessarily that you're always being challenged. It's because it's also when you're wanting to find out more information, and it's always genuinely surprised me how willing many people are to help you, to give you a lift up, to explain something that's quite complex. And all of that then helps you get over the difficulties that you're experiencing.
Thank you so much, Elizabeth. If you look back at 2020, the year that the World Health Organization designated as the International Year of the Nurse and the Midwife, and now they've extended it to the healthcare worker. What thoughts and feelings does it evoke for you?
It immediately evokes the sad fact that the COVID-19 pandemic brought to the world, but let's look at in the NHS, it really helped to clarify the role of health professionals. Now, obviously, there were many other people involved, but I am a retired nurse and I'm a retired health visitor. And what I could see, obviously in lockdown, so watching a lot of television, talking to a lot of my colleagues who were not retired, who were on the front line, knowing of the sad cases of those people that died, I could see in the media coverage how, for example, nurses were brought to the forefront of the public's attention because so many people, sadly, had to have contact with health professionals, and particularly nurses. Now, all health professionals are important, and in fact, all the staff involved with, for example, acute care, and we talk about porters, we talk about people that you don't necessarily see, it was clear that the pandemic brought these people to the attention of many members of the public who would not have come in contact with the health service. They came into contact with the health service due to tragedy, sadly. And the fact that COVID-19 is so contagious and how it spread and the fear that this brought and how people realize that the contact with an expert, caring NHS person such as a nurse was so vital to their physical and psychological well-being. And, you know, we talk about the health service looking after people from cradle to the grave, and COVID-19 really brought that to the fore, I'm afraid.
And if you had some advice that you would like to give to your younger self as a nurse or as a health visitor, what would that be?
Believe it or not, I was extremely shy when I was a young nurse. And part of that was that I wasn't aware of my full identity as a mixed race individual. When I found my father, I was at ease with both my full identity. Now that actually gave me inner confidence and made me a much happier person. And that came out in my nursing work, for example, in relation to sickle cell. So looking back, I would say build up your confidence a bit more quickly, because actually you enjoy life a lot more, you enjoy your professional work, you enjoy the people that you're meeting with more. Because if you are lacking in that inner confidence, you're so shy, you don't even notice when people are holding a door open for you. You don't notice when people in their own shy way are trying to make life easier for you, because you're actually a bit depressed because you're lacking in confidence, and so you're too inward looking, and you need to be more outward looking and have the confidence to relate to so many people. So that's what I think. I lost quite a few years of experiencing those positive aspects of my career simply because I was just too shy.
And you've written your memoirs as well, Elizabeth. Would you want to talk a little bit about the experience of putting on paper your life, your career, your thoughts, and also, I guess, your vision as well?
I self-published my memoirs firstly in late 2016, and so I've had about 5 years experience of the feedback that that has created. In addition, a publisher has now taken my memoirs up, so they're coming out in September 2021 with a new title and expanded. What it's enabled me to do is to reflect on my life, obviously, and I interviewed a lot of friends and colleagues to give me their perceptions of how they viewed me. You know, I'm 73, so a lot of people that have known me, and it's actually very cathartic, but it's also very healthy to get other people to talk about your strengths and weaknesses, because that's what I ask them to do, because that's the only way you can reflect about your life in a more faithful way, rather than your friends trying to be very nice to you and putting you on a pedestal or something. So it's been a very interesting process to look back at my life and realize that describing to people how, although I had a very difficult early childhood, I was living in care for the first 9 years of my life, and then I had physical abuse from my stepfather, but loving care, contact with my mother all through my life, and care and love from my maternal grandparents, and then, as I said, meeting my father. So it was a pretty jagged sort of early years. However, it has turned out all right for me, and I'm genuinely pleased how much my life story does seem to motivate people. And if I'm giving talks, I sometimes call the talk breaking through despite the odds. And I think a lot of people encounter challenges in their life that they feel might block them. My challenges came from being illegitimate, as it was called, mixed race, female, could go on and on. And yet I was able to turn it around with the help of family, colleagues and friends. So I'm I was actually quite surprised about the impact it's made, to be very honest. And I would urge other people to write about their experiences, because lives like my own had not originally been published a lot. This is changing, but it needs to change a lot more. So I think people who feel that they're not important, that they're not part of the establishment, hold on, hold your horses. There's a lot of people out there that would be very interested in hearing about your life.
This has been a remarkable 12 months for all kinds of reasons, Elizabeth. Do you have a message for society?
I think the message, it's brought us back to earth in a very shocking way, that makes us realize how important our friends and our family are, and that, you know, we shouldn't take lightly this word care. People, COVID-19 pandemic has struck, it's still striking, although I think things are getting better, hopefully. It's struck at so many people in so many levels, regardless of who they are. But it's also exposed health inequalities, and I think made it clearer to people that if people aren't treated equally, something comes along like COVID-19, then it gets into those weaknesses. If you're living in an overcrowded home, if you can't work from home because you work in a factory and you need that, everybody needs funding. But if you don't have the background and the support that enables you even to have some savings, that you need every penny that's coming in every day. And if so somebody says to you, you know, you've got to go to work, and you haven't got those options open to you, that you can work from home, and that home is warm and it's safe, and you've got space for the children and the other people in your accommodation, so you're not on top of each other, you're not facing domestic abuse. I mean, it really has shown up that many of us have privileges that we didn't even realize that we had. So I think I'm an optimist, and I hope that out of terrible sadness has come some awareness that people deserve. They're brought into the world, they deserve some basic human rights, and it's up to all of us to find out how can we help as individuals, never mind, you know, thinking it was only the politicians that can do anything. It's really woken people up in a very, I keep saying tragic, but in a very tragic way. And it's certainly made me realize how vulnerable we all are, and we mustn't be frightened of expressing our vulnerability, but also realizing what strengths we've got as well, and using our strengths to help whoever we can help individually. And that, you know, you can help people online. There's all sorts of ways that have opened up due to what's happened. And it's really important that we recognize the support that we need to give ourselves and to each other, because the world has gone through and is still going through a terrible experience, a really terrible experience. However, I can see the blue sky emerging, and certainly, who would have thought, I'm talking for myself now, I would never have thought that getting 2 vaccinations against COVID-19 would make me so happy. That's my personal experience, but it's actually an important experience for me. You know, I've taken vaccinations and immunisations not totally for granted because I'm a health visitor background, but fairly, but to realise that the public health aspect of life is really important, and that we have to protect public health. We really do.
Elizabeth, I cannot complete this interview without asking you about the Mary Seacole statue, as you were and continue to be the force behind its the establishment of this statue outside St Thomas's, Guys and St Thomas's. Is there anything that you would like to say about the journey of getting Mary up outside one of the major hospitals in the country?
Well, first of all, I'd like to acknowledge the work of Lord Clive Soley, because he set up the Mary Seacole Memorial Statue Appeal, going back now 2003, as a result of 4 Caribbean women who were his constituents asking him to help raise her profile. So first and foremost, I think it's always important to know the origins of how something happened, and how when we're approached, as I was approached by Lord Soley, with I think about 11 other people to become trustees, and agreed, because Mary Seacole meant so much to me as a Jamaican Scottish nurse, doctress, entrepreneur, feisty woman as well, as something, and who in her time in the Victorian era was actually very well known for her endeavours and support and care in the Crimean War. And then she got lost to history. So that is a lesson in itself about who decides who remains in history and who doesn't. And that her skin colour surely must have had something to do with the fact that she was literally whitewashed out. But she was brought back, so that's where the optimism comes. And so here was an opportunity to join forces and to enable so many others, thousands and thousands of people, to come on board, to give £1 here, £5 here, to raise £750,000, which, you know, really is a huge amount. And to have this memorial statue to a woman, a nurse, mixed race, on such a prestigious site in the grounds of St Thomas's Hospital and overlooking the River Thames. I've got a naughty sense of humour, I have to say. I love the fact that she's overlooking the River Thames and the Houses of Parliament, keeping an eye on the politicians and reminding politicians we need to care for each other and we need to support each other and we need to take risks occasionally, because she took risks. But what Mary Seacole Memorial Statue means for me is that memory of those 13 years nearly of hard work, but of all those people from all over the United Kingdom. I mean, I can't tell you, who came together, and it was just as online donations were coming on board, but it was also when people organised fundraising events. It was a beautiful experience, I have to say. And my memory is in June 2016, when her statue was unveiled. The days before had been very cold and bleak, and the sun shone that day that she was shown in public for the first time. We need memories like that, and our children and our grandchildren of all backgrounds need to see beautiful monuments. Martin Jennings, the sculptor, has to be congratulating for doing a wonderful monument of Mary Seacole. But she's there, and it's important that we talk about her statue and we talk about why she is important to us. And it's finally, it makes me feel that my daughter, my granddaughter, anybody that looks like me, and particularly from a nursing background, is valued. Every time my daughter, my granddaughter look up to Mary Seacole statue, we feel valued. And I think so many people walking past that statue should feel valued. And I also think we need to show our appreciation to St Thomas's Hospital, Guys and St Thomas's Hospital, for providing the site. And I know there are so many visitors that have seen that statue now. It's a good news story when we need good news.
Thank you so much, Elizabeth, for the tremendous amount of wisdom that you have. You're an inspiration to many people, including myself. So thank you so much for your time today.
Thank you for inviting me. Thank you.
Brilliant. I think that's recorded, so I can stop recording now. Thank you so much, Elizabeth. I really appreciate it. That's a fantastic